Hi, this is Andrew Phillips, the founder and editor-in-chief of EM Coach, and I'm excited to share this question with you because, wow, that leg looks terrible, right? And yet, understanding the progression of some disease with DVT is important because, in fact, with post-thrombotic syndrome, this leg doesn't need any acute intervention despite how bad it looks. Presuming a patient with a DVT has already been fully anticoagulated, this is what sometimes these legs can look like. And 20 to 50% of patients with post-thrombotic will develop post-thrombotic syndrome after DVT. And there's some literature about suggesting stockings to try to prevent it, and there's not good evidence that, in fact, stockings do reduce the risk of post-thrombotic syndrome. Regardless, this particular patient presents with post-thrombotic syndrome that's already developed, and there's nothing acute to do. You can try the stockings as therapy. There's mixed evidence for that. You can try some exercise. You can try some elevation. And for the most severe cases, people require endovascular intervention or some kind of general vascular surgical approach, but none of that's going to happen in the emergency department. So I find this a helpful question and helpful image to see because it's important to not unnecessarily escalate something that can be handled outpatient. So this is Andrew Phillips from EM Coach, wishing you well.